Hi everybody. Today we are going to learn about pulmonary embolism. What is embolism? Embolism can be a blood clot, or it can be an air bubble or a fatty particle or any substance that can travel along the blood circulation and cause obstruction to the blood flow. So what is pulmonary embolism? Embolism that cause obstruction to the pulmonary artery. So pulmonary embolism means it's a blockage of the pulmonary artery or its branch. And usually it's caused by DVT, that is deep vein thrombus. Thrombus means blood clot, so it's caused by a blood clot. If you look at the anatomy, this is the right side of the heart, which has deoxygenated blood, and left side has oxygenated blood. The pulmonary circulation begins from the right ventricle. This is right atrium, right ventricle, left atrium, and left ventricle. And pulmonary circulation begins from the right ventricle. So from the pulmonary ventricle, pulmonary trunk begins, and this trunk divides into right and left pulmonary artery. The right pulmonary artery goes to right lung and the left pulmonary artery goes to left lung. Remember, the pulmonary artery is the only artery in the body that carry deoxygenated blood. It gets oxygenated in the lungs and comes back to heart. So remember, right ventricle, pulmonary trunk divides into pulmonary artery, goes into the lung, and when there is an emboli, it is occluding the circulation to that area. So what happens when there is a pulmonary embolism? When there is a pulmonary embolism, it leads to ventilation perfusion mismatch. What is ventilation perfusion? Ventilation means airflow to the lung alveoli, and perfusion means blood supply. In order for our body to get oxygenation, there should be airflow as well as there should be blood supply to the lung alveoli. The embolism cause decreased blood supply to the area, so there is blood supply is reduced. That leads to ventilation perfusion mismatch. And when there is a mismatch, remember, gas exchange won't take place, and as a result, patient gets hypoxic. This can lead to cardiopulmonary distress. Along with this, pulmonary embolism decreases blood flow to the area. As a result, it can lead to pulmonary hypertension. When there is pulmonary hypertension, remember, the pulmonary artery originates from the right side of the heart. So there's a backflow of blood to the right side of the heart that leads to right ventricle strain. What causes pulmonary embolism? Usually it's caused by DVT, deep vein thrombus. This is the blood clot that forms in the deep vein in the extremities. This blood clot can dislodge and travel to the pulmonary artery, causing emboli. What are the other reasons? Amniotic fluid emboli. The amniotic fluid is found in the uterus. It surrounds the baby, but when the fluid escapes into the maternal circulation, it can lead to pulmonary emboli. Placenta. Small parts of the placenta that escapes into the maternal circulation can lead to pulmonary emboli. Air emboli. When does air emboli happen? During surgery, when a large amount of air escapes into the circulation, or through an IV catheter, intravenous catheter, it can lead to air emboli and a pulmonary emboli. Next is fat emboli. This emboli happens when there is fracture of the long bone, and from the bone marrow, fatty particles escapes into the blood circulation and can cause fat emboli. Parts of the tumor can lead to pulmonary emboli, or it can be also due to septic emboli. Now let's see, what are the risk factors? Surgery or trauma. Associated with this, bed rest and blood trauma or damage to the blood vessels also contribute to pulmonary embolism. Another risk factor is prolonged immobility, example in hospitalization or a long journey It all can cause venous stasis in the lower extremities, venous pooling. And as a result, blood clot can happen and lead to pulmonary emboli. Obesity can lead to pulmonary emboli. Hypercoagulability, that is any blood disorder that leads to clotting disorders or cancer or in malignancy patient, increases the risk of PE. Smoking, previous history of DVT, presence of IV catheter can increase the risk. Certain medication that contain estrogen, example oral contraceptive pills. If a person is on OCP pills and also smoking, remember that patient has a high risk of getting a PE. Also, as age increases, it increases the risk for PE. What are the signs and symptoms? Remember, it's the blood clot or emboli that blocks the circulation. As a result, patient may experience chest pain that worsens with breathing, shortness of breath, heart rate may increase, breathing may increase. Patient may feel signs of anxiety, sweating, fainting, heart palpitation, coughing of blood, and may exhibit signs of shock. What is saddle PE? Saddle PE means PE that occurs at the bifurcation of the pulmonary artery. Remember, from the right ventricle, pulmonary trunk begins and it bifurcates. It divides into right and left pulmonary artery. If the emboli is at the bifurcation point, it's a dividing point, then it's called saddle emboli. And this emboli can be fatal because it's large enough to obstruct a large amount of blood flow to the lung, or it can break into small and cause multiple emboli. So this is very fatal. How can you diagnose PE? Sometimes PE is misdiagnosed or difficult to diagnose because the signs and symptoms associated with PE is also seen in other conditions. But some of the blood tests done in PE include D-dimer. What is D-dimer? It is a protein produced when a blood clot is formed and it breaks down in the body. The normal level is less than 500. So a negative result means less than 500 means a clot is not present. But what if the positive result or it's greater than 500 means a clot may be present, but it is not specific. That means D-dimer can be elevated in some other condition, example trauma. So a positive D-dimer means it's a high risk. Also, more testing is needed to confirm the presence of PE. Second is ABG. In arterial blood gas, you will see sudden drop in the oxygen level that can suggest PE. Coagulation profile. It includes coagulation studies include PT, APTT to rule out any coagulation disorders. And next we'll see some of the imaging tests done to rule out PE. It includes CT pulmonary angiogram, also called CTA or CTPA. In this, a contrast is injected into the vein during CT scan, and it helps to identify any block in the pulmonary vessels or in the pulmonary arteries. The next include VQ scan. VQ scan means it's ventilation perfusion lung scan. During the scan, instead of contrast, a radio opaque dye is injected, and it helps to identify any filling defects. Usually this test is preferred when CT pulmonary angiogram cannot be done or when it is contraindicated. Example, if a patient is allergic to the dye, contrast, you cannot do CT angiogram. Or if it is a renal patient in acute renal failure, because this contrast used for CT angiogram is renal toxic, it can damage the kidneys. So if the patient has or the patient is in renal failure or allergic to this contrast, then the preferred method is VQ scan. Other tests involve pulmonary angiography. It includes a catheter is inserted into the large vein in your leg and is threaded to the heart through the pulmonary arteries, and then a contrast is injected and X-ray imaging is done to identify any filling defects. Now let's see the management of PE. The primary management include anticoagulation or blood thinners, example heparin, or low molecular weight, example Lovenox. Heparin can be given intravenous or subcu. And remember, this is not clot busters. It does not dissolve the clot, but it stops the formation of new clot and prevents the old clot from getting bigger. Along with this, in patients, they are started on PO warfarin and wait till PO warfarin gets effective, and patients are discharged on PO warfarin for 2 to 3 months. Other medical management include thrombolytic drugs. What is thrombolytic drugs? These drugs are clot busters. That is, it helps to dissolve the clot and reopen the blood vessels. Example include streptokinase, urokinase, TPA, etc. But before prescribing, before ordering thrombolytic drugs, patients are screened through certain contraindication because these drugs has a very high risk factor of sudden severe bleeding. And if contraindicated, anticoagulation is preferred. Other surgical management include IVC filter placement. What is IVC filter? A filter is placed into the renal inferior vena cava. This filter filters the blood and prevents the blood clot from reaching into the pulmonary arteries. This is indicated when patient cannot be anticoagulated because of the bleeding risk or high mortality from recurrent PE. Other surgical management involves emboloctomy. Emboloctomy means surgical removal of the blood clot. This is done again when anticoagulation is not possible or when the surgeon can directly visualize the clot and able to remove the clot. Now let's see how can you prevent pulmonary emboli. Prevention of pulmonary emboli involves identifying the patient who are high risk for DVT or PE. Example, patient who require long hospitalization or immobilization, orthopedic surgery, very high risk for PE. So those patients are treated with prophylactic anticoagulation. Other measures include early ambulation post-op, use of elastic stocking or mechanical compression device, example SCDs. This promotes blood circulation back to heart and prevent venous stasis and blood clot. Third is anticoagulation. So today we learned about pulmonary embolism, and thanks for watching my video.